part of WCCC's vision is to be a learning-centered college focused on student success. In keeping with that vision, to help our students succeed, the nursing program is developing a series of videos to enhance the education of our nursing students. Medication Administration, the 10 Rights. The process of medication administration is an extremely important part of nursing education. Unfortunately, errors do occur during medication administration. Our goal for this video is to eliminate those errors by providing an educational tool for our students who administer medications. Nurses who administer medications are responsible for their own actions. Before giving any medications, you should first assess the patient. What is the patient's blood pressure and pulse rate? Are they nauseated? Do they have a fever? Are they having difficulty swallowing foods or liquids? Are they having any pain? These are all factors that affect how you would administer medications. The right medication. It is important to check your medication with your MAR to make sure it's the right medication, and remember to always check the expiration date. The right dose. It is always important to make sure this medication is the right dose for your patient. Take the time to look up any medications you are not sure of. The right time. Remember, medications are considered on time 30 minutes before or after the ordered time. The right route. Always check to see how your medication is to be administered. Is it to be given orally, or in the IV, or by injection? The right patient. Properly identifying your patient is vital to safe medication administration.
Anna Jones, 8/17/57.
Thank you, Mrs. Jones.
The right patient education. Patients need to know what their medications are and what effect they can expect after taking these medications.
I have some medications here for you to take this morning. I'm going to be giving you your Lasix and also your Coolace. The Lasix is to reduce the swelling in your legs, and the Coolace is to help you have regular bowel movements.
The right documentation. You should initial your MAR only after you have given the patient their meds. If a medication is being held, you must document why the medication is being held and notify the physician if necessary. The right to refuse. Patients have a right to refuse, but the nurse needs to explain the problems the patient might encounter by not taking the medication. If the patient still does not want to take the medication, then proper documentation and physician notification is necessary. The right assessment. It is important to always check pulse rates and blood pressures and review administration parameters prior to giving the patient his medications. The right evaluation. After giving medications, you should always evaluate your patient to see if the medication has been effective. If you remember these 10 rights of medication administration, then you will be able to safely administer medications to your patients. In summary, let's review the 10 rights of medication administration. Number 1, right medication. Number 2, the right dose. Number 3, the right time. Number 4, the right route. 5, the right patient. Number 6, the right patient education. Number 7, the right documentation. Number 8, the right to refuse. Number 9, the right assessment. And number 10, the right evaluation.
There are different types of medications, which are oral medication. And under this oral medication, it is given through oral, which is being swallowed by the patient, sublingual route, which is dissolved under the tongue, buccal route, which is held inside the mouth of the patient until they are dissolved. And also, oral medication can be administered through the nasogastric tubes. Parenteral medications are given through injections and infusions. And under this type of medication are intradermal, which is allergy testing or tuberculin skin testing, usually administered under the skin that is in the forearm, in the upper arm, or across the scapula. Subcutaneous medication is injected in the subcutaneous tissue layer of fat below the dermis. Intramuscular is injected into the muscle layer beneath the dermis, and intravenous medication is injected directly into the vein or through various access devices that placed in the vein after vein puncture. Another type of medication is inhaled medication, which is induced or to induce anesthesia and to treat respiratory disorders. Suppository medication, this is inserted into the rectum or vagina. Topical medication is placed on the skin surface, mucous membrane, or body cavities. An example of these medications are lotion, cream, and ointments. There are also medications under the classification of drops and ointments, and these are ophthalmic medications. These are solutions or ointments used to treat eye infections and glaucoma and eye irrigation. Ear medications, these are solutions dropped into the ear to treat external ear infection or to soften and remove earwax. Nasal medications are solutions sprayed into the nose to treat